All right, good morning, everyone. Welcome to the Thursday, May 20th, 2021 Joint Boards of Health and Hospitals meeting. So I would like to officially call the meeting to order and call for the approval of the Zoom video that serves as minutes from the April 18th meeting of 2021. May I have a motion to approve the last meeting Zoom video meeting minutes?
So moved.
May I have a second, please? Thank you, Dr. Ross.
Second.
Thank you. So we will proceed with the agenda. So our first agenda item will be the COVID-19 update on data testing and vaccine distribution from Dr. Eccles.
Good morning, everyone. As many of you all noticed, that things have been relatively stable across the St. Louis region. The case counts as well as the percent positivity for the city of St. Louis as well as neighboring jurisdictions have been relatively stable. And at this point, the city 7-day average for new COVID-19 cases is hovering around 20, and the 7-day average for percent positivity is right at 5%. In addition to that, hospitalizations in the St. Louis metropolitan area have also relatively stabilized across the St. Louis Metropolitan Pandemic Task Force hospitals. With those things, taking those things into account, the City of St. Louis Department of Health and St. Louis County Department of Public Health met last week to discuss the next steps in our COVID-19 response. One of the things we wanted to do was to streamline mitigation measures across both jurisdictions, which will simplify things for residents as well as business owners and visitors. And so last Friday, the City of St. Louis and St. Louis County rescinded previous health orders and adopted essentially the CDC guidelines. And so we are encouraging every resident business owner in the City of St. Louis and visitor to comply with CDC guidelines as it relates to COVID-19 mitigation measures. We still have a ways to go. The vaccine uptake across the St. Louis metropolitan area is not where we exactly need it to be. And so additional efforts will be conducted to increase awareness, increase information sharing as relates to information about the vaccine products that have been approved by the FDA under their Emergency Use Authorization Authority. Of concern, however, are gaps that have been identified as it relates to zip codes and vaccine uptake. In the City of St. Louis, there are 5 zip codes, which are all in North City that account for the lowest, had the lowest percentage of vaccine uptake for COVID-19 vaccines. And those zip codes are 63120, 63113, 63115, 63106, and 63107. After talking with some of our stakeholders in the community, such as the schools who have hosted quite a few vaccination clinics, some of the concerns that have been raised are from the parents and caregivers, particularly in the minority communities, about whether or not the vaccine is safe for individuals, particularly youth, age 12 to 15, actually 12 to 17. And so at this point, a lot of them aren't comfortable with their child receiving the vaccine. And so we have to conduct additional efforts to learn what those reasons are for them not wanting learn more in depth reasons about why their children, why they aren't willing to have their children vaccinated at this point in time. Also within the immigrant population, so there's some cultural concerns as well as concerns about the effect of some of the vaccines on individuals' lives. And particularly, we've been communicating with the Somali community, and of concern, particularly as it relates to the Johnson & Johnson vaccine, was the concern of death, primarily amongst the women of childbearing age. So there was recent some uptake of the vaccine amongst the men in those communities, but the women are still hesitant to receive the vaccine because they're concerned about death, they're concerned about dying. So we're really sensitive to those issues and their concerns. And so we don't want to dismiss them and just try to push vaccine on them. And so instead, we really want to do our due diligence to hear them hear what their concerns are, because as we look at the history of vaccine uptake in the city of St. Louis and the St. Louis region, and even across the state, it has not been ideal by any means. And so some of the immunization rates for city of St. Louis are probably some of the lowest in the state. And so what we have to do is figure out how to really hear parents' concerns about vaccines and take that into account and figure out ways to make sure they get the information they need to make informed decisions, because there's still a lot of misinformation that's circulating in our community as relates to the COVID-19 vaccine and other vaccines that are available to protect the health of our community. And so part of our efforts are going to be working with Washington University and some of the other academic institutions to conduct projects that have been funded by the Centers for Disease Control to obtain a better understanding of the impact of COVID on our communities, but also obtain more information about how the impact of COVID has influenced their decision as relates to getting vaccinated. And so those are some really major projects, because those extend beyond COVID-19. As I mentioned, the vaccine uptake for youth in the city of St. Louis have been some of the lowest in the state. And so we have to make sure that we are addressing the root causes of it, not just putting a Band-Aid on COVID, but really figure out how to increase awareness, increase uptake for some of the other vaccine products that have been approved. And we're doing that. Messaging has been a challenge as well for some of the vaccine products that are on the market, particularly the one that comes to mind for most individuals is the HPV vaccine, which was essentially marketed as a sex vaccine when it was initially put on the market, in particular a sex vaccine for women or for females. We all know that that's not true, and what the ultimate intent for that particular vaccine, as we all know, is cancer prevention. And so, but what happened was the damage was done, and so we're still undoing some of that damage by having to go out and do educational sessions for families, in particular working more closely with schools so that they have accurate information as well, because sometimes the schools serve as the first stop point, the first information point for families. So making sure the schools have accurate information is going to be important as well. So part of our outreach efforts are going to include reaching out with schools. So I've already met with the school administrators for the school systems in the city of St. Louis and offered for us to help hold a town hall for their parents, again, just to hear what the parents' concerns are, and if some of the teachers have concerns, because again, they're the first information point. And they're not providing accurate information, or they have questions that haven't been answered yet, then that can create additional challenges for the public health agencies and the medical providers. And our other goal is to also engage more medical providers. We've been able to do a decent job over the course of the pandemic, working more closely with St. Louis University, Washington University, BJC, SSM, other hospitals in the city of St. Louis. But there's still work that needs to be done as it relates to connecting with private providers. And so we've started doing some of that work, but there's still a lot more work to be done, because they play a critical role as well. Again, just similar to the schools, oftentimes the medical providers serve as that first information point. And so we want to make sure that the medical providers are also aware of the intent and the initiatives that the health department is putting on. And so there's a way for us to provide them with additional information, or if they can serve on a panel for us to better engage their patients. That's something that we'll be looking to do over the upcoming months.
Thank you, Dr. Eccles. Are there any comments or questions?
Yes, I do have a question, Dr. Eccles. Regarding the vaccines, if someone who took the vaccines, let's say today, are they, is it effective until next year and they have to retake it, redo the vaccines again, or what's the research shown so far?
So that's something we're still learning. So we still don't have all the answers at this point in time. But based on what the CDC's guidance, they have, initially that was the 90-day period after an individual completed their vaccine regimen that they didn't have to quarantine or isolate, but they removed that time period. And so as we learn more information, then the guidance will change. But at this point, there's still a lot we don't have an answer to all the questions at this point. So we're relying on the researchers and our federal partners to obtain as much information as possible so that we can make informed decisions and relay whatever policy changes need to happen to our community.
I have a comment to make. So in regards, I heard you talked about the Somalian people and the immigrants. So I know I shared with Harold the list of immigrant stakeholders. Perhaps I know if we get a chance to reach out to those individuals, they'd be a stronger voice than the health department, because those are the individuals working with them. So I encourage us as soon as possible to reach out to those stakeholders, the list that was shared, so we can address any concerns or issues other immigrant populations may have with the vaccine.
And that's a great point, and that was done, and so we're grateful that they are serving as good partners for us. So not only with the Somali community, but also we have stakeholders in the Hispanic Latinx community that are being champions for us. So they're being the face of the event, so that that removes that additional barrier of stigma, as well as being a government agency that they may carry if the health department is the face of the engagement. So they're doing that work for us, and we're grateful that they came to the table as a willing participant to help us with this effort.
Dr. McBride had a question.
Yeah, thanks, Dr. Eccles, for your report. With regard to the vaccines and the vaccine uptake, particularly in those North City zip codes, those 5 zip codes, and I believe, if I'm following it correctly, the mass vaccine events have stopped. Or maybe not, I don't know. So, and my question is about, are we doing any attempts to do special access in those 5 zip codes, or where do they have access through pharmacies? And also, what messaging are we doing in those particular areas or to those communities?
Great. Yep. So the FEMA community vaccination site is still up and going. So
okay, sorry.
They're here until June 1st. We're actually working with one of our media partners, Streets 1051. They're doing community engagement. They're actually piggybacking on the health department's barbershop and beauty salon program. So they're going out into those venues to educate individuals and remind them of the opportunity to receive the vaccine at the site downtown. In addition to that, they're also doing other events or other activities. A commercial has been developed, and it'll be on major networks such as BET, Nickelodeon, and some of the other channels across the regions. And so that those should have aired this week. And for more community-based vaccination clinics, so those have started as well. So we've held a couple of clinics down in South City, and we'll be working with organizations in North City over the upcoming weeks. One partnership that we've established is with the Herbert Hoover Boys and Girls Club, and this will focus on, again, families, but also those youth that are aged 12 to 16 who are eligible to receive the vaccine. If I don't recall correctly, that vaccination clinic will be held at the beginning of June, but we'll have others between now and then.
Thank you. Sorry for the misinformation about thanks for correcting that.
No problem.
Are there any additional comments or questions? I have just, thank you for your presentation, Dr. Eccles. Is there any information about vaccination uptake in the unhoused community and how that's going?
So the health department, we have been working with Department of Human Services. Some efforts have been conducted by other organizations such as the Urban League with the national collaboration with the National Guard. They held a few small vaccination clinics for the unhoused, but we're working to really streamline that a little bit more. And so we're working with, we've been working with Amy Bickford, who's over their housing programs for the unhoused. And so to get more information about those who are those who want to receive the vaccine, and also identifying a good site for us to administer the vaccine for them, and also work out any transportation, social support issues that may need to be in place in order for those individuals to attend.
Thank you.
If I could just follow up on that question. Last month, we spoke about the number of individuals in the Justice Center and Medium Security Institute. I think there were, you mentioned around 150 individuals who wanted the vaccine. And have we made any progress in helping those individuals become vaccinated?
Yes, we have. So that's the other project that we've been doing. So we've been providing the Pfizer vaccine for the Justice Center as well as the Medium Security Institute. And though that's been going really well, so we work with the Horizon Health, who's the medical service provider for the correctional facilities, and they coordinate the clinics. So they let us know when they need the supply, and then we deliver those. And so we're at this point, we've over 100, maybe over 170 individuals are fully vaccinated. And so, and they continue to poll the inmates and also some of the staff, because some of the staff are also are not fully vaccinated. And so they continue to survey those individuals to get more information about for those who have had a change of heart, so that they can be added to the list. And when they schedule the follow-up, the following clinics, they'll be included. And so they'll have enough supplies for them.
Okay, great to hear. Thank you.
Thank you. Any last questions about COVID vaccine distribution? All right, wonderful. Thank you.
One important thing that I think we have lost sight of is things have been so heavily focused on COVID that we forget about what the conditions were before COVID-19. And so when we look at vaccine uptake, again, as I mentioned before, is taking into account what the status was, not only for youth, but also for adults. There was a lot of hesitancy before COVID-19, and then to have vaccines developed over a short period of time, although they were done in a sound and scientifically responsible, ethically responsible manner, there's still hesitancy, and that raises more questions for our community. And so I think just being sensitive to that and being in tune with that is really important for all public health departments and all medical providers who, I think right now the focus is uptake, but what's causing the hesitancy? I think addressing that root cause is really important. And I think some of our stakeholders and partners want to get answers to those questions. So Serena and the RRT, as well as some of the other organizations that are working to get better inform the community, but also hear the community. They're doing some really great work. And so we're looking to really extend our partnership, expand those partnerships moving forward.
Thank you, Dr. Eccles. Any other questions or comments? Great. So our next agenda item is our accreditation updates.
So that will be presented by Craig Smith.
Well, good morning. As you know, we had a presentation on the 5th, primarily on accreditation. Dr. Eccles uploaded the 3rd year accreditation report before the deadline of May 5th. It was that day that we had the retreat presentation. We will have another report due, and then of course some of the more heavy lifting in terms of working again on the reaccreditation portion of that. I'm not going to go through obviously all of the FAB accreditation pieces we talked about on May 5th, some of those governance parts of that, and there are obviously, I don't know that it's obvious, so I will say it again. The board is not so much reviewed. The burden is on the health department, obviously, to make sure that you are truly and fully engaged and that you are working with the health department in a number of different areas. There are 2 measures and 4 requirements. Most of those are narrative in nature. And I think that there is more than enough material in terms of the presentations and so forth that have been provided to the board, as well as a number of things that the board has done, including, of course, the June proclamation of the racism as being a public health issue. But I do think that it bears repeating some of the thoughts for continued governance engagement. So those would be, and some of this comes from the report, because I know the report and FAB for accreditation, the Public Health Accreditation Board, is always interested in terms of the stability of the Public Health Department. And so really identifying, obtaining, and retaining public health resources, which include funding, which is part of our resources. Also intervening to retain stability of the department leadership and supporting Department of Health authority. Some of that has undergone a great deal of trauma, I would say, in Jefferson City this past session. The amount of that was limited to some extent, but I think obviously going forward, and Dr. Eccles just sort of talked about pre-pandemic, there's this constant sort of, I would say, sort of a laissez-faire attitude toward public health. And even with the intervention of COVID, there are those who have had efforts to try to limit the ability of the public health department to work with public health in emergency kind of situations. And so there was some legislation, which I will look at in more depth, but basically limits the ability of public health departments in the state of Missouri to issue emergency orders beyond 30 days before having to go, in our instance, to the Board of Aldermen to get additional authority to continue on basically for incremental times to have those kind of emergency orders, which are so important. And also the vaccination issue, which thankfully was kept in abeyance this particular session, but continues to raise its head. So those issues about what vaccines do and the benefit for community will continue to be an issue that I think will be important for the governing board as well. The reviewing support and advice on policy development. So some of these things that are impacting us not only locally, but nationally and at the state level. And of course, much of what impacts us on the local level is so much influenced by what happens in Jefferson City. Supporting workforce development and training. We are so blessed to have great academic institutions in St. Louis. Many of you represent them here. And so continuing that connection is so vitally important. And of course, our workforce is, along with our public, two of the most tremendous parts of the resources that we have in addition to the leadership for the health department. Collaborating to provide evidence base for public health and continuous quality improvement. I don't think that needs a whole lot more said, but obviously that is so important, and continuing that culture. That is somewhat constrained and difficult in times of COVID when we've been separated and we've been zooming along through things, but is still part of what we do as public health. Obviously engaging and connecting with community partners is so relevant and important, and all of you have so many partnerships which you help us to leverage. So the department has 136 employees, and each of those employees have very many partnerships, and they're working throughout the community. But obviously the Board of Health is so important at another level in terms of leveraging those partnerships. Considering continued participation in the strategic plan implementation groups, which I know that Dr. Eccles reflected upon on May 5th as well. And then, of course, supporting that reaccreditation, the community health improvement plan, community health assessment, and the strategic plan, all those things that make up sort of that blueprint for how we move forward as a public health department. That constitutes my report for today.
Thank you, Craig. I have a question. Could you just give us an overall timeline for the accreditation process?
So I know that Dr. Eccles continues to look at that. The accreditation process is ongoing. It never stops. But our next accreditation, I believe, is in 2023, but we will be up to our arms and legs and everything else in next year. But obviously on a daily basis, continuing with the continuous quality improvement and evidence base and all the rest of that is a continual thing. But for FAB, the significance will be for us to be able to show and demonstrate that all these things are happening. And then, of course, having our various aspects with the community health assessment and community health improvement plan will all be part of that whole system of the accreditation. And so that will be in earnest next year, as I understand it, Dr. Eccles.
Correct.
Also, I did want to mention that I am just this interim person who is here, but I know Dr. Eccles is looking for an individual to be able to make sure that we stay on track, which is a daily, hourly sort of effort to try to take all the great work that does happen in this department and make sure that we are accounting for that as part of the FAB accreditation.
Greg, thanks for that report. Thanks also for alluding to the board's proclamation about racism as a public health threat and acting upon that. I think that really illustrates how the board asserts a priority, and that priority then translates into significant policy development within the mayor's office and our board of aldermen. So it is highly connected, obviously, to our efforts here in accreditation to really discuss how the board implements policy. Can you give us an update, or maybe Fred can give us an update on where that proclamation is in the mayor's office?
Absolutely. So the proclamation has been drafted, but as we thought about racism, so over the past few years, the phrase has been racism is a public health crisis, but when we really look at it, it's really a human rights crisis. So it extends far beyond just the boundaries of public health. And so this requires system level effort to really have sustainable change. And so there's some action steps that we're trying to lay the foundation for. And so the mayor's office is really engaged with that. And so that we'll be presenting that in the future. But they are engaged. They have reviewed the document, but they want to make sure that again, it's not just a proclamation that's read, but that there are some actions that follow the delivery of those words.
Thank you.
Any other comments about the accreditation process?
I think one thing I want to kind of piggyback on, so with as Craig mentioned, so this is an ongoing process. We have the time periods where we have to submit documents to the accreditation, the Public Health Accreditation Board, but this is a culture issue. So this is a culture change for a lot of health departments. And so for quality improvement, that's one of the things that was missing in the city, in the health department. We didn't have a dedicated staff or program for quality improvement. And so a quality improvement performance management position has been added to the health department's table of organization. And so we're working to fill that position as well. Again, because all the programs have to work in tandem, but as we are implementing these different quality improvement projects, we need to make sure that they're properly documented so that, one, it helps with succession planning, but it also helps with making sure we're able to tell our story, not only to the FAB, but to local stakeholders, elected officials, so they can understand the work that the health department is doing. Because there's a lot of great work that has been done, but if it's not properly documented, we really miss our opportunity to tell our story. And so just over the past few months, we've been identifying areas where policies can be used to address things such as communication protocols between the health department and external stakeholders, make sure that's properly documented so the appropriate individuals receive the information. So there's a lot of quality improvement efforts that are happening, and we're working to make sure that they're properly documented, but again, having a dedicated staff to kind of oversee that work, as well as assist staff with the program implementation and their logic models and other quality improvement tools that they're using to evaluate their performance is really important. And I want to give the board a heads up as well. So the last board report that I think you all received was back in 2019. There was some quality concerns with the report. And so our epidemiology team has worked with the all of the programs and some of our external stakeholders to identify the appropriate metrics that need to be reported out to the Board of Health. And we want to make sure the report is meaningful so that you all can understand the work, the quality of the work that the program is, that the agency is doing, but also that you all can see the reach. Because a lot of the programs that we implement on behalf of this department extends beyond city boundaries. So a lot of our programs are regional. And so we want to make sure that you all understand the reach of the program as well as the quality of the work that's being done. And so we're planning to have our first iteration of the updated board report submitted to you all before the next board meeting.
Wonderful, thank you. And I just have another comment about the proclamation for racism as a public health threat or a public health crisis that Amanda Holmes and some of the other team and the health department is really trying to make systematic change in looking at racism, anti-racism and equity strategies and processes within the health department to make sure the health department itself is functioning to combat racism and to include and to create equity and inclusion in all of its functions and actions. So they've been working hard at that and working with SLU and other community and academic partners to identify strategies and procedures and ways to make sure that the whole concept of equity and anti-racism is infused in all of the health departments working. So I'm happy that they're moving forward with that. All right, do we have any other questions about accreditation? Okay, so next we will have Dr. Dominic Moshe give a presentation on St. Louis cancer statistics. So just before that, just one quick second, Dr. Moshe, we have a little bit of an agenda change. The special opioid presentation, we will actually table that until June. And then we'll have Mayor Jones's comments at around 9 o'clock. So Dr. Moshe, if you are ready, we are ready for your presentation.
Good morning to all.
Good morning.
Okay, let me minimize this one. Okay, I'm going to present about the cancer incidence in the city of St. Louis. As you can see, the figure on your left side, the cancer incidence rate from 2013 to 2017 is higher in the city than in the state and the national figure. The highest incidence in the city was observed in 2014, with the rate being 500 per 100,000 population. However, the incidence rate have been declined at each level over time, but with a sharp increase that was observed in the city from 2016 to 2017. About the cancer incidence by age, sex, and race, we can see that cancer incidence is higher in male than female. And figure on your right side, we can see that the cancer incidence is higher in Black African American population when compared to white. Figure at the bottom, we can see that the cancer incidence increases with age, with the peak observed from 65 years and above. About 10 leading sites for cancer incidence in the city. You can see the figure on your left side, the leading ones being breast cancer in female, prostate cancer in male, lung and bronchus cancer. These are the three leading ones. In the list, as you can see, non-Hodgkin's lymphoma and pancreas. So when you try to stratify this by sex, we can see that the three leading one cancer in male population are prostate, lung and bronchus, and colon cancer excluding rectum. And this accounts for 50% of all cancer in male. And this agrees with the National Cancer Institute report of 2021. On the side of female cancers, the leading ones are breast, lung and bronchus, colon excluding rectum cancer. Again, this accounts for 43% of all cancer in female, as reported by the National Cancer Institute report 2021. About the staging of cancer at diagnosis, I think this is important when determining the prognosis of the cancer. In the figure, the bar with orange color represent late stage diagnosis, and the blue color represent early stage diagnosis. What do we see in here? At least 60% of prostate, breast, urinary bladder, corpus uterine, and kidney and renal pelvic cancer were diagnosed at early stage, whereas more than 40% of lung, bronchus, pancreas, colon, and non-Hodgkin's lymphoma were diagnosed at late stage. I think here the emphasis will be the first two bars, and these are prostate and breast cancer. Given the existing screening interventions that are in place, I think we should expect the early stage diagnosis of these two cancers should be around 800%. But what is the picture when we try to look by race among early stage cancer diagnosed? We can see that percent of prostate, breast, lung, corpus uterine cancer diagnosed at early stage slightly favored whites over black population. But this was not the case when looked at kidney and renal pelvic cancer as well as urinary bladder cancer. On the side of mortality, from 2013 to 2018, cancer mortality rates were higher in the city of St. Louis than the Missouri and the national figure. The highest prevalence was observed in 2014, which was 205 rate per 100,000 population. But the good thing is that cancer mortality has still declined in both city, state, and the nation, as you can see in the figure. About on the side of mortality by age, sex, and race, all-cause cancer mortality rate is higher among female than among male than female. This also we observed, in the previous slides on the side of incidence. Also, all-cause cancer mortality rate is higher among Black than white population. As you can see the figure on the right side, and all cancer mortality rate increases with population age. With the sharp increase, as you can observe, from 45 years and above. Again, this also agrees with the 2021 report from the National Cancer Institute. When we try to stratify cancer mortality, in the city by sex, we can see that the leading cancer in terms of mortality in male population, the first one is trachea, bronchus, and lung cancer, followed by prostate, and the third one is colon, rectum, and anus cancer. Those are the leading ones, on the side of male. But when it comes to female, we can see the leading one is trachea, bronchus, and lung, breast, colon, and rectum. These are the top three. What can we conclude from this? Actually, what I can say is that the average cancer incidence rate for the city of St. Louis is higher than the state and the national figure. About 66% of breast cancer and 71% of prostate cancer were diagnosed at early stage. We think more can be done to increase the chances of diagnosis in this cancer, at least to around 80%. Unfortunately, you can notice that the Hispanics, figures reported, and this is, I can say, it's part of the limitation, as Hispanics are underreported in Missouri death certificates, and therefore data should be interpreted with caution. I can set an example here. In the report, in the cancer mortality counts from 2015 to 2017, out of 3,049 counts of deaths, there are only 32 deaths reported among Hispanics, which actually this is about 1%. So we think, there's information that is missing, in this particular population. That's all. I think, thank you for your attention. I welcome your questions, comments, and remarks.
Thank you so much, Dr. Moshe. Do we have any questions or comments from the board?
I have a question. I don't know if this is something that Dr. Moshe can answer, or maybe someone else on the board as well. When I saw the statistics around it looked like the lung cancer is traditionally caught later. There's not the early detection there. And it also seemed to be the greatest contributor when it looked at the mortality rates. I'm wondering if that's an issue of the way that it's detected, that it's just more difficult for early detection, or if it's an awareness issue that people aren't being screened. Like, what do people know about how that particular statistic is showing up?
Yeah, okay, thank you for your question. Maybe I'm going to try to answer. Actually, the cancers which are easiest to be screened are the two, as I mentioned, the prostate and breast. It comes to the lung cancer and leads to the other colon and others. Actually, the screening actually seems to be challenging. I don't know if physician in the house maybe can intervene and assist me on this. But actually, I think more needs have to be done in this area. But the interventions that are in place on this particular type of cancer is not as effective and not as efficient when compared to the prostate and breast cancer screening.
Thank you.
Dr. Blue.
Yes. Any trying to scan through and look for questions. Dr. McBride, do you have a question?
Yeah, thanks, Dr. Moshe. Great presentation. Thanks for the information. It's hard to keep all the balls in the air while the COVID pandemic's going on. And, as we know, and the departments had their hands full, the whole healthcare system has. One thing that I feel like I've picked up on my reading and such is, that people are reducing their use of primary care prevention during COVID and the pandemic. And it sort of makes me wonder about, it's not your fault, of course, but these data end in 2018 or 2017. And so I'm wondering about, it's a question we're just going to have to keep pondering. I worry about the lack of early detection prevention that might have happened in the last 12 to 18 months, in particular in some of these real problematic areas of, as you say, breast, prostate, lung cancer. I read something I felt in the last couple of days about lung cancer and smoking prevention that might have lagged during the COVID pandemic. So I don't think there's an answer you have to that, other than, now that we're sort of emerging a little bit out of the pandemic, that we turn our eyes towards getting patients to get in there and get their tests.
And I think what it highlights for me is the need for chronic disease prevention programming by all health departments. So when you look at the again, a lot of these chronic disease or health promotion programs for the city's health department was really essentially stripped away. And so when you strip away the program that's responsible for doing outreach and community engagement around these very issues, then you shouldn't be surprised to see the rates go up. And so we've been working to, again, engage primary care providers, but we also have to do a better job of engaging community members on these very topics as well, so they understand the importance of routine screening. And we do that for sexual health, for STIs, STI screening, but they also need this for, prostate and breast cancer screenings, lung cancer screening, just overall general health screening, but also creating opportunities for them so that they can navigate the health systems more efficiently. I think during one of our previous meetings, we talked about the class standards and making sure patients know how to advocate for themselves. And I think there's still some challenges with that, especially in the areas of the city where there's high poverty and individuals are uninsured or underinsured. They may not know how to navigate the system. And then even for people who are insured, sometimes it can be difficult navigating the system. And so one of our tasks as well is to make sure that we are able to help the community navigate the system better so that they're empowered to achieve optimal health, because that's what our vision and mission is. But we can't do that if we're not properly, if the workforce isn't there. And so this, for me, justifies the need for chronic disease prevention programming for the health department.
Thank you. Do you have a question? Let me make sure. I'm just trying to scan to make sure there are no other questions. Are there particular partnerships that have been developed during COVID in order to some of the communities that are disproportionately burdened with an increase of cancer, morbidity, and mortality are the same communities that have been disproportionately burdened by COVID, morbidity, mortality, and challenges with accessing vaccination and some vaccine hesitancy. Do you think you'll be able to leverage any of those that were built during COVID to protect the community from COVID, to also leverage those to move forward? All of the same risk factors and social issues that facilitated a disproportionate burden of bad COVID outcomes in certain communities are the same set of circumstances that cause the cancer disparities, and it just continues to play out in multiple health issues. So are there plans or discussions between the city and the county or within the city health department about taking at least some good from the pandemic and some of these newly formed partnerships and moving them forward to help to address some of these other issues and disparities?
Absolutely. So that's exactly the intent. So as we built partnerships and nurtured pre-existing partnerships over the course of the pandemic, we were very intentional about making sure that they were the right agencies at the table. And so our goal is to not let these relationships dissolve after COVID-19 is deemed to be over, but to really continue to work with these organizations moving forward in a way that we can maintain our reach in the community and making sure and ensure that they have not only information they need, but they have access they need to these health and social service resources. And again, that is something that needs to be done across both jurisdictions, so the city and the county. So we'll continue to work with St. Louis County Department of Public Health, and also there can be some lessons learned from some of the other local public health agencies as well, such as St. Charles County. We all have somewhat different experiences, and we have we look at our social vulnerability index across the different jurisdictions. There's some variability there. So I think there's some lessons learned. There are some ways for us to partner and to lead with some evidence-based and performance-based best practices.
Thank you. Any other questions for Dr. Moshe? All right, Dr. Moshe, thank you for your presentation and for just keeping us up to date on cancer stats and for non-COVID. COVID's critically important, but all of the other health issues and challenges that existed before the pandemic are still still there, and we still need to address those as well. So thank you for that presentation. So we do expect Mayor Jones in a couple of minutes. And our remaining agenda items are the board committee reports. So I will go ahead and start the board committee reports. Usually they're pretty brief, and then we can continue when Mayor Jones, we can stop when Mayor Jones comes on and then wrap them up after her comments. So is there a brief report from the Governance and Nominating Committee?
Sure, Rhonda. So I think our update right now is the same as it was on May 5th. Some of the committee members met with the attorneys from the city councilor's office. We are going to, the committee's in the process of drafting a memo that would be authored by, we're just writing a first draft of a memo that would go from under the signature of Dr. Ballou and Dr. Eccles to the mayor's chief of staff and one of her chief policy people, to let them know about some of the changes that need to be made to update our charter and how we sort of start that process. I think we had a long conversation with the city councilor's office about the proper procedure for updating our charter. We'd like to do so with a bill that would be passed by the Board of Aldermen, and perhaps proceed that way rather than through a full ballot initiative that would have to be voted on by the entire city population. But we will have to wait and see what the city councilor's office and the mayor's staff determines on how we proceed procedurally to make some of the needed changes to our charter. So all of that is in process, and by our next meeting, our goal is to have a memo off to the mayor's office and have the ball sort of rolling on this. So thank you.
Thank you for that update. Any questions from the board? All right, thank you. Any comments on the Academic Health Department Committee, Craig?
Yes, so quickly focusing in on the Academic Health Department itself. I mean, we all know that that's the city, county, and St. Louis University. One of the things that we're going to be, that we are working on currently is the conference. And Dr. Ross, I don't yet have a date. I know that we're meeting tomorrow. Perhaps we'll have a more definite date. And they also know of that interest in trying to see if there would be a way to somehow work and definitely not compete or have a conflict in the schedule with the Institute for Public Health. But the conference, which would involve, we believe, Nebraska, but certainly Kansas City, St. Louis City, and St. Louis County, sometime between October 4th and the 17th. Some of the things that we're working on, and Janine is here, she may want to pop in and say something about this, but I know that we're definitely looking at how we develop some of that infrastructure. A really great opportunity that has come up as a part of this, in addition to the internship process, is the ambassador program, which allows students, and they don't necessarily have to have been at the level to avail themselves of an internship. They can take advantage of a ambassadorship, which allows them to come in for 40 hours, which would be during a period of time. I may have the exact hours incorrect, but I know it's 4 weeks to try to do brief projects where they can kind of get a taste of what public health is. And that may in itself later on turn into an internship. Janine, did you want to speak to that a little bit more?
Sure, I could say a word or two. What with the SLU team for the academic health department, the goal is that we have a list of potential ambassadorships available to the incoming Masters of Public Health students in the fall, so that they have a kind of a menu of what kinds of opportunities are available at the City Department of Health. And the county will probably be doing something similar to that. So I'm hoping to work with the managers and supervisors at the Department of Health to help develop those ambassadorship descriptions over the coming couple of months. Thanks.
And Dr.
Wonderful,
Blue, I
thank you.
saw the mayor.
Mayor Jones is here. So I know she's extremely busy. So Mayor Jones, thank you for coming. And then we can just continue our committee reports after, so we can continue with questions on the academic health department. Craig, can you answer questions after Mayor Jones gives her comments?
Absolutely, we want to hear from the mayor.
Yes, so thank you, Mayor Jones, for attending. I know that you have back-to-back meetings, so I don't want to delay. So thank you for attending the board meeting. And we will proceed with the rest of the agenda after. So welcome, Mayor Jones. Thank you very much for attending.
Yes, thank you for having me. My apologies for being a little bit late. I'm literally running between meetings. I figured that the only way for me to be on time as I was leaving the RPC this morning was to stop at home between Clayton and City Hall. So you have my lovely background of my house. So good morning, everyone. So good to see so many friends of mine that I have worked with in public health for so many years. I don't know if a lot of you know this, but I had a whole career in public health before I got into politics. And that means I must have started that when I was 3. I was able to work under the tutelage of the late, great Betty Jean Kerr at People's Health Centers, as well as at SSM Cardinal Glennon Children's Hospital, where I had my first fellowship after I completed a master's in health administration at the St. Louis University School of Public Health and Social Justice. So I'm a proud graduate Billiken. But also that background informs my policymaking and how I lead and come to this office, because I do understand the intersection of health as it relates to all of the things that we are tackling in this region right now. And many of you heard, and I stay committed to this, when I was on the campaign trail, I talked about declaring gun violence as a public health crisis. And because, I see that as imperative to tackling our gun violence issue in our region, not just in the city, but in our region, because a lot of times we don't take care of the health of our citizens. We all know through many, many reports that have been done on the health status of our citizens or of our region that African Americans are at the bottom of all of the bad outcomes, and Black and brown people are at the bottom of all the bad outcomes when it comes to our health. And our community health centers and other public health entities do the best that they can in what I call doing God's work and trying to take care of the marginalized and those without insurance. And so I look forward to working with this board, as well as our flagship hospitals, to bring all of our resources to the table to address gun violence as a public health crisis, because I believe that we all have to be at the table with solutions, with all of the prevention tools in the toolbox to connect public health to gun violence, and to connect public health to the future prosperity of this city. We cannot expect our city to thrive and grow if we don't take care of the health of the people who live here. So please know that you have a partner and an ally in my office who gets it, who understands the intersection of healthcare and good healthcare and quality healthcare that we have in this region to how we will move our region and our city forward. And I wanted just to thank you for allowing me to give you just a few minutes about who I am and where I'd like to see our city go. And I look forward to working with you in the future.
Thank you so much, Mayor Jones, for your comments. Do you have a moment for any questions?
I sure do.
Questions or comments from our board?
Yes, Mayor Jones, yes, we're absolutely delighted to have you here. And this is a time when, fortunately, you are well positioned to be in receipt of significant federal funds to allocate to our city. And obviously, you certainly know that Missouri ranks dead last in terms of public health funding per capita. We're dead last. So we're asking, in light of the priorities of the city, how will funding be how will you move in allocating appropriate funding to the Department of Health, to the Board of Health? Department of Health.
That's a great question. So many of you know that the process to distribute those funds has been one that's been public and transparent. We have a survey currently out there for people to weigh in and let us know what their priorities are. We also have a stimulus advisory board that meets every 2 weeks to give input, and those meetings are also public and people can join those meetings on Zoom and provide their input as well. But also, I would expect our acting director of health to weigh in and make sure that his needs are known. But again, I think we have a great opportunity in that the mayor has a master's of health administration and sees that intersection, right? So please know that as we move forward and as proposals are presented, I will be the one asking those questions of the intersections of health and race as we spend the money and make sure that these investments are ones that are going to bring returns for many, many years to come.
Thanks. Well, we're very encouraged.
Thank you very much. Any other questions?
Hello, my name is Dr. Davis, and it's such a pleasure to have you join us here today. We're so encouraged by what the future of our city looks like with the clear vision that you have for it. We've been enduring and trying to survive this pandemic, and now I think we're getting a little bit closer to our new normal. And one of the areas that you've touched on has been this disproportionate impact on Black and Brown communities, for which COVID is not new. We know this. These disparities have existed across public health states and medical conditions. My question is that, now that we've started to see the CDC and the highest levels of leadership understand this, and there's increasing funding towards initiatives such as centering community leaders, community partners, my concern is that this doesn't become another one-shot attempt and thoughts about sustainability. Can you speak a little bit about what you'd like to see come out of these COVID efforts as far as the long-term health and prosperity, especially of our marginalized communities?
Yes, so we have seen, or at least I have seen, a renewed focus, or I guess a renewed attention on bringing several stakeholders to the table to have these conversations and make plans on how we address the intersection of race and health in our city and in our region. And we've seen some focused attention on how Black and Brown outcomes were the worst during COVID, and now how they are and how they are within our health systems, right? I would love to see continue that these sort of task forces don't just fall away after COVID is over, right? Or after the high point of COVID is over. And so just earlier this week, when I was on the Metropolitan Task Force meeting, I implored them to stay together. That I said, okay, well, I'm not saying that COVID is over and we tackled this, but what are the other issues that we can work on, since we have this collection of hospitals and experts at the table who are looking at it from all different angles? How do we stay engaged and involved with this task force, and what's our new mission? So I'm going to be pushing for that. I've already mentioned it on the call, and sometimes now I'm noticing people listen to what I have to say. But again, because of my background, because I know these intersections all too well by actually working in it for several years, please know that that's something that I'm going to be pushing.
Thank you, Mayor Jones. Well, I would like to just thank you for your time. I know you're extremely busy, and thank you for making the time to stop by our meeting. And we look forward to working with you and to having someone with your experience and background to work with us to improve the health of the citizens of St. Louis. Thank you very, very much.
Thank you for having me, and thank you all for your work.
Thank you. Do you have any questions for us?
No, I have no questions. It's like I said, it's good to see so many friends that I have worked with over the years, even before I got into politics. So this is I just look forward to working with you and continuing our push towards declaring gun violence as a public health crisis, and how we can work together to address that.
Wonderful. Thank you, and have a wonderful day. Thank you very much. All right. That was great of her to stop by. I just want to get back rolling with the agenda. We have 15 minutes left in our allotted time. I know, Craig, did you have any additional comments about the academic public health partnerships?
Well, just to reflect, obviously, the importance of our department coming up with some of those opportunities for ambassadors and continuing the work that Janine and others are doing in terms of creating that infrastructure. Also, since the mayor spoke to this, and I know that Serena is also here from in her role at times from the Violence Prevention Commission and so forth. There are a lot of things that are occurring in the background, one of which is putting together an opportunity for some research that would involve faculty over at St. Louis University, along with a couple of questions in league with St. Louis City, St. Louis County, and the Violence Prevention Commission to try to look at some of the questions that could be helpful in terms of that. So violence, substance use disorder, the chronic diseases, as Dr. Echols was talking about, none of those have been forgotten, obviously, and they continue to tug not only at our emotion, but also in terms of our backgrounds and in the work that we're doing in terms of public health. And that's it. I think we're ready to move on. Thank you.
Thank you. Any questions? All right. The Health Communications Committee.
I think before we go there, Tim was trying to say something, but I don't think his mic is working.
Sorry. Dr. McBride.
Tim, you may have to use the chat. Yeah.
All right, let's move on with Lisa, and then Dr. McBride, if you can send your question in the chat, we can.
Okay, thank you everyone for participating in the profiling that we've been doing of our board members, both through Zoom interviews and photographic sessions with Lindy Drew of Humans of St. Louis. We are going to wrap that up in the next few days, having interviewed most of our board members, and soon to be everyone, hopefully. And then we will be able to see our profiles before they get released to the world, hopefully by June 1st, which is next week. Then we talked yesterday with the Department of Public Information folks about doing a press release or something to let the world know ahead of the posting of these on the Humans of St. Louis website and on our website and Facebook page link, that we've got these wonderful stories to share about who each of us is professionally and personally, to the extent that you wanted to share that, and also what public health is and why it's important. And I think it will help raise our profile, which has been our goal for the last, I don't know, 3 or 4 years, as long as I've been on here, build awareness in the city and an understanding of what we do. So I thank you all for spending time on this activity, and I'm hoping that it'll be good and it'll help advance all of our all the projects that we're collectively doing as volunteers and staff on the board. We will have a communications committee meeting before the next board meeting, which means I will send out inquiries to those of you on the committee probably next week as to when we can schedule a 1-hour meeting to see what our next agenda items are. We're in the process of wrapping up our communications marketing agency contract with Elasticity at the end of June, and we're evaluating the highs and lows of that experience and where we go from here with outside resources to help our communications going forward. So that'll probably be one of the topics to do a little brainstorming on some ideas for future direction to continue to build awareness and perceptions across the city of what we do. That's it. Thank you.
Thank you so much, Lisa, for coordinating those Humans of St. Louis interviews. It was fun. Lindy was great, and I think it going back to the proclamation of racism as a public health issue, and Dr. Eccles mentioned that it's a human rights issue. It's good to kind of bring the humanity and to show that just the humanity in public health, and I think that this initiative helps to do so. So thank you so much.
Welcome.
And I see Dr. McBride's question was about the scheduled dates for the
I was starting to
public health conference.
I was starting to respond to that, Dr. Ballou, but so as we're supposed to meet tomorrow, the planners are aware of the potential for conflict with the Institute for Public Health, and hopefully they will not do that. And obviously it would be helpful if there was some way to coordinate with that. I don't know where that exactly stands in that particular detail. It is likely to be between sometime October 4th to 17th.
Okay, maybe you can hear my microphone now?
Yes.
Good. I wanted to ask a question of Mayor Jones, but I couldn't get it in because my microphone just stopped, which is fortuitous for the rest of you. But so I think the conference for the IPH is October 27th. You may know that, Craig, but that's what it says on my schedule. And anything I can do to help you, liaise with them. Sounds like it'll be, go ahead.
You got it. Your ears are going to be ringing tomorrow.
Okay. So we don't want them to be stepping on, the same dates. So yeah, that's what I was just wanting to make sure. So I'm glad you guys are doing this, and that's what I have on my calendar is October 27th. So
thank you for that.
All right, thank you. And hopefully we'll look forward to updates about both conferences so we can support those conferences. The last committee updates, just ad hoc committee participation, and I can just cover that briefly. That is, we might have the need for ad hoc committees related to helping coordinate the conference or some other board business that might come up that we might need participants, even participants from the community, to be on some of our ad hoc committees. So, as we move forward in initiatives and some of the other board initiatives, we might assemble, or we're able to assemble. And Linda, we might need to talk about that in terms of the charter. They certainly wouldn't be permanent committees. I don't think that goes against our charter or anything, but if we need some more assistance and insight from additional stakeholders, we can assemble ad hoc committees. So last items. Oh, yes.
On that topic of ad hoc committees,
Mhm.
it reminds me of what Mayor Jones gave as a response about how they're going to allocate funding for public health, that they have a stimulus advisory board. And I wonder if there's an opportunity for this group, because we're also an advisory board to the Department of Health, to support that process when they get to the topic of allocation of resources related to health. Not to duplicate effort, but is there a way for us to also contribute our expertise to that process, strictly as it relates to public health investments?
And if I could just jump in, Serena's reading my mind, or we're in the same zone. I was thinking the same thing when Mayor Jones was speaking. Obviously, it sounds like we have an ally in the mayor's office. She understands health and race and gun violence. But some of the Dr. Maddie's question about keeping the foot on the pedal in terms of the long run funding, not just the short run issue of COVID, is, I think, just as Serena points out, if there's a way to get input into that survey and to the stimulus committee to sort of make sure, I'm an economist, so I would say money's fungible. So if the Department of Health gets more money for X, that means that they can allocate their budget's just a little better in the long run. But 2 years down the road, we want this to look better as well. Apologies, Serena, just to piggyback on your comment.
No, I think that's all a good addition. And what I would encourage us to do as we're thinking about long-term processes is to try to build on the infrastructure that currently exists.
Yes.
So if there are issues where there are standing advisory groups that meet regularly to discuss these issues, then how do we connect those groups to new groups that may emerge around special charges such as the Stimulus Advisory Board, so that they're not disconnected?
So if we could, thank you, Serena. Dr. Eccles, do you have any information about our ability to attend those meetings? Is that some information that we can get, and what's open to the public, and what we could, how we can participate as board members?
Yes, what I can do is, so I think the meetings they have that group is already set for the mayor's office, but they will be working with me to figure out the public health request. And so what I can do is work with the board. And so what we can do is send out a survey and figure out amongst the board what you want. Yes, I'll let you know what the immediate priorities are for the health department. And then there are other priorities. Like I want as much input as possible to make sure that we aren't missing any opportunities. And so I aim to get that information, or at least the survey, out to the board by the end of the week. And then next week we'll compile the information and put some funding amounts to it. And we can submit a clean package to the mayor's office for consideration.
Thank you. Serena, you had
Dr. Eccles, the next meeting is May 29th at 10 a.m. And I believe, as the mayor said, anybody can, I know for certain, listen in. I'm not sure exactly how they handle the testimony, but I think that's an excellent idea, not necessarily for the board to be there always with the presentation, but being able to hear that and engage in that conversation at the ground level.
Right.
And Serena, did you have a comment about that?
I was just going to say the same thing, that the meetings are open to the public and anybody can watch, but it's set up as a webinar, so you can't ask questions or anything like that. And what I'm thinking about is more of, to Dr. Eccles' point, how do we support him as he's making recommendations for that particular body? So anybody can attend, but I'm looking to see if there's an opportunity to have a more formal connection between advisory boards that currently exist and new boards that arise that are issue specific. And in this instance, because Mayor Jones specifically mentioned allocating resources for public health, we have a public health advisory board. So how do we make sure that we contribute to that process to the extent that we can?
So I think Serena's making a great suggestion, and to build on what Dr. Eccles said, if he can go forward and then say with their survey that he's sending out, we did a survey of the board and they say X, that should lend credibility
I
beyond.
think the survey was for dates for us to, I thought. I heard
Okay,
that.
I'm
Yeah.
sorry. Okay, sorry, I misunderstood.
All right, so we'll be getting some additional information, right, Dr. Eccles, about how we can contribute.
Yeah. Okay, sorry.
All right, thank you. Any departmental updates, Dr. Eccles?
Yeah, so the health department, our budget for the FY22 year is coming up. So I'll be meeting with the city's Ways and Means Committee next Wednesday, I believe at 11 a.m. And so you all can tune into that if you're inclined. We'll be essentially presenting the information for our upcoming year budget justifying the request for the FY22 budget to the Ways and Means Committee from the Board of Aldermen next Wednesday. And then on a lighter note, you know that this has been a very stressful year for a variety of reasons. And so one of the things that the health department wanted to do is give the staff an outlet to be stressed a little bit, but also have fun. And so we had a walk run challenge during the month of April. And so I just want to announce the winners for the competition. So we had a team competition and an individual competition. The first place team was our communicable disease team. They logged over 451 miles over the month of April, followed by our women, children, and adolescent health team, who logged 416.21 miles, and our fiscal team, who logged 395 miles over the month of April. And then for individuals, our first place winner is Mr. Emmanuel Kani, who's our fiscal manager, and he logged 142.1 miles, so he carried the load for the fiscal department. And our second place winner is David Courtney, who's one of our disease investigators. He logged 137 miles during the month of April. And our third place winner is Alyssa Kepner, coming in at 87.2 miles. So we're aiming to maintain health and a good balance for our staff here. And so we were grateful that they participated and got some miles in along the way.
That's wonderful.
Setting an example.
Great to hear.
Thank you. All right. Any old business or announcements? All right. We are at 9:30, so I will. Was there something?
Oh no, sorry. I said wow. Very efficient.
All right, so I will move to adjourn, and our next meeting will be at on June 17th. So until then, stay healthy, stay safe, and everybody have a great day.
Thank you.
Thank you.
Thank you.